In a matter of weeks, Guyana will be adopting a new testing methodology for the novel coronavirus, one that offers a cheaper and faster option of diagnosing persons with COVID-19 when compared to the polymerase chain reaction PCR test. During Wednesday's COVID-19 update, Minister of Health Dr. Frank Anthony said the ministry has signed off on an order for 20,000 rapid antigen test kits. While the minister did not disclose the cost of the kits, he noted that they're being acquired through the Pan American Health Organization, World Health Organization.
This antigen test is one where right at the site where you're seeing the patient, if you suspect them to have COVID, you can run the test there, and within 45 minutes you will get back the results. So we have placed an order for 20,000 such tests. And hopefully by sometime in November, we will be able to get those tests. And once we get them, the idea is to deploy them to the interior areas.
Since the start of the COVID-19 outbreak, the PCR test has been used to diagnose persons infected with the coronavirus. The PCR test requires the insertion of a nasal swab into the nostril, after which samples are taken to be tested at a national reference laboratory. The antigen test also utilizes a nasal swab but does not require a laboratory setting to determine the results. Dr. Anthony stated that some additional testing machines are also being procured to further increase the national testing capacity for the virus.
We will probably be able very shortly to do about 1,000 tests per day, but we are working on it.
It is important to note that another form of rapid test for COVID-19, also referred to as the rapid antibody tests, should not be used to diagnose persons with the virus. Last week, Chief Medical Officer Dr. Narain Singh informed Nightly News that despite warnings, several private hospitals were conducting the rapid antibody tests.
Because the sensitivity and accuracy it's not as compared to PCR. Most of the rapid tests can be used as a screening test. You can screen someone, but even then it's not very, because the sensitivity and the specificity for these tests are kind of low. And so it's only to the rapid test, you can't diagnose a patient either positive or negative based on a rapid test.
Timeka Rodney reporting for the HGP Nightly News.